Hello, everyone. In today's video, we are going to explore together 8 odors that may be associated with cancer and that, surprisingly, often go unnoticed. These olfactory signs can be key to identifying the disease in its early stages, which, as you can imagine, can save lives. Stay with us until the end and, if you like this content, leave a 1 in the comments. If it's not to your liking, leave a 0. Your opinion is essential so that I can improve the videos more and bring valuable information to you. So, without further ado, let's get started. 1. The smell of mold. A warning for mouth and throat cancer. Did you know that an odor that resembles mold or rotting wood can be an early sign of mouth or throat cancer? This condition, often silent in its early stages, can surprise by the presence of a peculiar smell. This odor is caused by tissue necrosis and the release of volatile compounds by tumors, which accumulate and manifest themselves in the breath. Unfortunately, this sign can be confused with oral hygiene problems or dental infections, delaying the search for specialized help. In addition to the musty smell, be on the lookout for symptoms such as persistent hoarseness, difficulty swallowing, wounds that do not heal, unusual spots in the mouth or throat, and unexplained ear pain. If you or someone you know has this set of signs, consultation with an otolaryngologist or oncologist is essential. Detailed tests, such as biopsies, CT scans, or MRIs, can offer a more accurate diagnosis and increase the chances of successful treatment. 2. The odor of decomposition. A warning for colorectal cancer. Colorectal cancer is among the leading causes of mortality worldwide, but its early signs can easily be mistaken for common gastrointestinal problems. One of these signs is a noticeable change in the odor of the feces, which can acquire a much stronger, persistent fragrance and even comparable to decomposition. This change occurs because the tumor interferes with the digestive process, releasing toxins and gases that modify the natural smell of the intestine. Other symptoms that may accompany this change include the presence of blood in the stool, constant abdominal pain, changes in bowel habits, and unexplained weight loss. As many signs only appear in advanced stages, early detection through the observation of olfactory changes can be crucial. If you notice persistent changes in this odor, it is important to perform tests such as colonoscopy or imaging analysis to investigate any anomalies. 3. The sweet that scares. The smell related to breast cancer. Although breast cancer is widely known and investigated, there is a less commented sign that can be determinant, a sweet and, at the same time, unpleasant odor coming from the skin or wounds associated with the tumor. This peculiar aroma usually appears in more advanced stages, when infections and tissue necrosis enter the scene, causing inflammation and releasing specific chemicals. In addition to this olfactory sign, other important indicators include the appearance of lumps in the breast or armpits, changes in skin texture or color, abnormal secretions, and persistent pain in the region. Often, this sweet smell is mistakenly attributed to simple infections or hygiene problems, which can lead to a delay in diagnosis. It is worth remembering that breast cancer has high cure rates when detected early, so attention to any change, including odor, can be decisive. 4. Smell of sulfur on breath. An indicator of gastric cancer. Stomach cancer is a treacherous disease, as its initial symptoms are vague and difficult to identify. A sign that deserves attention is breath with the smell of sulfur or rotten eggs, resulting from impaired digestion and the release of sulfurous gases. When the stomach is affected by cancer, it loses the ability to process food properly, which generates this persistent odor that does not disappear with good oral hygiene or changes in diet. In addition to this sign, gastric cancer can manifest itself through abdominal pain, early feeling of satiety, loss of appetite, nausea, vomiting and, often, unexplained weight loss. If you identify this strange and persistent odor associated with other digestive symptoms, it is essential to see a gastroenterologist for further evaluation and tests that can detect the problem in a timely manner. The horror of the smell of rotting flesh, a sign of skin cancer. When it comes to skin cancer, especially melanoma, the visual changes in the skin are usually emphasized. However, one of the most unusual signs can be the odor of decomposing flesh, noticeable in open wounds or lesions that do not heal. This unpleasant smell is a result of necrosis of cancer cells, which release volatile compounds in the process. Often, these lesions are located in areas that are difficult to see, such as the back or scalp, and can be mistakenly associated with simple hygiene problems or superficial infections. If you notice that a wound or lesion on the skin has a persistent and unusual odor, don't hesitate to see a dermatologist. Early diagnosis of skin cancer considerably increases the chances of effective treatment and, consequently, survival. 6-year urine alarm. The smell of ammonia and kidney cancer. Kidney cancer is a serious condition that often develops silently. One of the less conventional signs of this problem is the change in the odor of urine, which can take on a strong, pungent ammonia smell. This aroma arises when the kidneys, responsible for filtering the blood and eliminating toxins, begin to fail due to cancer. It's important to note that not every ammonia odor signifies the presence of cancer, as urinary tract infections, severe dehydration, or even high-protein diets can cause similar changes. However, if this smell persists and is accompanied by symptoms such as back pain, the presence of blood in the urine, extreme fatigue, or unexplained weight loss, it is essential to seek immediate medical attention for a complete evaluation. 7. Metal in the air. The metallic signal and blood cancer. Some hematological diseases, such as leukemia and lymphoma, can manifest themselves subtly, and one of the most peculiar signs is the metallic odor, which can be perceived both in breath and sweat. This smell, reminiscent of rusty iron or ancient coins, arises due to changes in the levels of iron and other chemical compounds in the blood, caused by the interference of cancer cells in the production and destruction of normal cells. Because it is a subjective sign that is difficult to measure, it is often ignored, being confused with variations in diet or environment. However, when this metallic odor appears along with symptoms such as extreme fatigue, persistent fevers, recurrent infections, and unexplained weight loss, it is essential to seek a detailed medical evaluation to investigate the possibility of blood cancer. 8. Sweet odors that no one wants to feel. The smell of lung cancer. Finally, we come to lung cancer, one of the most insidious forms of the disease, as it can develop without showing visible symptoms for a long period. In some cases, however, an unusual sign may emerge, a sweet and slightly fruity odor, noticeable on the breath. This aroma is due to the release of volatile organic compounds produced by cancer cells, which alter lung metabolism. Unlike common bad breath, this sweet smell does not disappear with oral hygiene and can persist for months, being easily confused with conditions such as digestive problems or metabolic changes, including diabetes. Therefore, if you notice this persistent odor with no apparent cause, seek a pulmonologist for a detailed evaluation and tests that can identify the presence of abnormalities in the lungs. I hope this information has been enlightening and helpful to you. By knowing these signs, you will be better prepared to identify possible early warnings in your health or that of those you love. Remember, early diagnosis is essential to increase the chances of cure and the success of treatment. If you found this content relevant, don't forget to like, share it with your friends and subscribe to the channel to receive more tips and information that can save lives. Stay tuned to your health, stay informed and see you in the next video.